All right, we're going to go ahead and get started. Thank you so much for joining us for this information session on the California Community Service Learning Program. My name is Tanikia Jackson, and I am the programs consultant with the National Medical Fellowships, and I'm also here with Ellie Ogai.
Hi, I am the program associate.
And we have a program coordinator as well, Desiree Torres, but she is currently out sick today. Just to give you a little bit of information about the National Medical Fellowships, we are based in New York. We've been awarding scholarships for minority, underrepresented minority medical students to increase diversity in the field. So let's move forward. All right. Our mission is to increase the pipeline of physicians and health professionals and to bring in more diversity to the health professional pool, particularly with underrepresented minorities. The way that we do this is that we provide scholarships, which are just a monetary award. We offer service learning programs, which our monetary award, and the scholars have to complete a project. And we partner with national and regional organizations such as the California Wellness Foundation. This is a service learning program, and like I said, it comes with a monetary award, but you also will complete a project that serves an underserved community. This program was put into place in conjunction, as I said earlier, with the California Wellness Program, and it is the reason that it was put into place was to invest in underrepresented minority health professionals and underserved communities, to develop future leaders in the medical field, to promote community involvement of those future leaders, and to support community sites and their constituents. Each scholar who successfully participates in the program will receive a $5,000 award or scholarship. Program eligibility. So we are looking for 10 scholars for this award, and those who are selected do have to be a U.S. citizen, identify with one of the following underrepresented minority groups: the African American, Latino, Native American, or Asian American, specifically Vietnamese or Cambodian only. Demonstrate leadership at an early stage, have a commitment to serving medically underserved communities, and be enrolled at an accredited medical school in California. So while NMF has programs that are available to students kind of all over the United States, this particular one is only available to students who are in California. The project. So scholars will complete a health project that is a minimum of 200 hours in duration, takes place between February and June of 2016, is self-directed, and reaches an underserved community group. So you may have some questions about the health project, and we're here to answer those today if you do. The 200 hours does take into consideration the time that you spend planning your project, as well as meeting with your site mentor to develop your project or guide your project, and we'll talk more about site mentors in just a bit. It does not include the time that you spend writing your final report or final papers. We do stress the importance of reaching an underserved community group, so your community projects have to take place within a community that has kind of obvious health disparity, because that is one of NMF's main goals, and the way that we do that is to empower medical students to accomplish that throughout the country. You can work with a partner on your project, but you have to come up with 2 separate projects that support each other rather than just working together on the same project. Both of you do still have to do 200 hours. You will have to write separate final reporting papers, presentations, that sort of thing. And if there are 2 people who are interested in working together, you can let us know, and we'll be happy to talk through that with you if you have more questions. Examples of previous projects These are the titles of them and kind of gives you some information about what they did. One was a program to understand and improve patient-centered care for elderly populations. Another student did women's health workshops. Two students, an example of a dual project. One student, they did running towards a healthier Linux, and one student did working on workshops throughout the school year with high school or middle, I think it was middle school students, and then the other one worked on a community health fair at the end, but the students presented at that health fair. So the projects worked together, but were not exactly the same. And they used the same students to do it, which was really helpful for them. And then the Loma Linda Durable Medical Equipment Exchange, where a student helped people who were disabled for a short period of time get the equipment that they needed. So I wanted to show you guys the NMS Resource Library, and this is something that we've made available with just a list of the projects that have been done within our service learning programs. So this is the page for California Community Service Learning Program. And as you can see, we have a list of previous scholars. We have their school, we have their project title, where it was done. So you can also reach out to any of these places if you're near them. And maybe you could host your project there as well. They are already familiar with us, and so that might give you some it might help you to find a site to work with. And then we also have the key outcomes listed. But over here, if you click on PDF, then you can also see the PowerPoint that the students did while for their final presentation about their project. And so this can give you insight into issues that they may have run into, what was it like for them being in the program, and what can you expect as a CCSLP scholar. And we have a couple of other programs up there, and any of them where the student was focusing on a community project might be helpful for what you're interested in doing. So program elements. In the program, you will have you'll have to have a site mentor, and the site mentor helps to guide your project. They should be knowledgeable about the subject that you are addressing, but they should also be knowledgeable about the site where you're going to be, because you need someone who can help you gain access to the resources of the site, make sure that you have that you understand how the site works, that you can get in, and all of those really logistical things around having a project at a community site. You will have to do monthly reporting, and so that just talks about what you did that month, what were the achievements, what were the weaknesses or issues that you ran into that month, how did you overcome them. You will be writing final reports, a paper presentation and poster, and I think it's a really good idea in your monthly reporting to write things that stand out to you, because they may be helpful to you later when you're writing your paper. Now, of course, these are totally different lengths. Your monthly reports can be as short as just a paragraph, but the paper is going to be from a minimum of 5 to 10 pages, but, you know, it's like taking notes along the way. And then we have a culminating event. And the culminating event brings all of the scholars together who are in the program, and it's an opportunity to meet them, network with them, find out what they did, and to just kind of build relationships with the people who are interested in similar things as you are. And also it just facilitates discussing the projects and sharing ideas. It is mandatory for scholars to attend the culminating event. So our application is available online. If you have not been to the website, this is the page for the CCSLP application. And these are the elements of the application: medical school transcript, student report, verification of citizenship, financial aid transcript, which is a document that we already have, and as you're filling out your application, you'll see that there is a line that requests for you to send a request to someone in your financial aid office, and that email request that will go out will have the form attached to it. So all you need to provide is that person's name and their email address. You'll have to do 2 personal statements, and the questions are listed on the website. the Community Health Project proposal. So you do have to have an idea of your project when you are applying. We don't expect for you to have everything figured out, but you should kind of know where you're going to have it, who you're going to be working with, and what your goal is for the project. Your CV, a bio sketch, 2 letters of recommendation. One of them should come from a dean, faculty member, or just chief administrative officer from your academic institution, and the other should come from a community leader or volunteer supervisor. And then documentation of your loan history. And as I said, the website really has very detailed information on each one of these elements and exactly how to do it. One thing I will point out is that your 2 personal statements, as I said in the requirements for eligibility, you have to demonstrate leadership at an early point in your career, and also a commitment to serving underserved communities. And those personal statements is really where we have the opportunity to see that come out. So I would suggest really kind of taking your time on those and making sure that it portrays you clearly as a person who has that commitment and that leadership. Doesn't have to be 10 pages. Just there's a limit to the words, just so we know. All right. Okay, so that is all of the information that we have for you today, and I'm going to unmute you just in case you have any questions. If you are not able to talk, you can type in a question. All right, it looks like we don't have any questions today, but please feel free to check out our website, contact myself, Desiree Torres, or Elio Guy if you have any questions, and scholarships@nmfonline.org is the email where you can submit any questions that you have, and here's our phone number as well. All right, we look forward to getting your applications. Have a great day.